Limb anomalies, the nursemaid elbow. This is a common thing to happen in a toddler, the nursemaid or the nanny. It's more common in the toddler child, so that's about a 1-year-old to about a 5-year-old. Look for sudden traction on the arm. This is a patient, it's also known as a radial head subluxation. So look for a patient who has had sudden traction to the arm. Sometimes the nursemaid, the parent, will yank on the arm and you'll hear a pop and the child will start to cry, or the child is being held by the hand and maybe he or she throws himself to the ground because of something, they don't want to do something, and there'll be a sudden traction and then the child will hold his arm in a certain position. Typically, the arm will be pronated, the hand will not be used, and there's pain on movement at the elbow. So the child will hold his arm basically like this, in this position, and he doesn't really want you to move it much. The elbow is okay. Palpation is not so bad. Part of your differential diagnosis, obviously, is going to be a fracture, and so sometimes you might want to get an x-ray. And when you get the x-ray tech pops it back into position, and now the child is fine, it doesn't hurt anymore. So that just basically it's a clinical diagnosis by the history and the way the child holds their arm, and then you can just reduce it yourself by just gently popping it back into place.